Dear students, welcome back. Now we are going to see 12th rib. 12th rib is one of the atypical rib present in the thorax, and it has no angle no twist, and it is also not having any neck and tubercle, and also no costal groove is present on the 12th rib. So it is having two ends, that is the anterior end and the posterior end, and it has a large single articular facet on the head which articulates with the 12th thoracic vertebrae, and because of the absence of tubercle it does not articulate with the transverse processes, and the anterior end is pointed here. Okay, now coming to the shaft. This is the shaft. We have finished the ends. So posterior end, that is head, is having only a large facet for articulation with the body of the 12th thoracic vertebrae. It doesn't have neck, tubercle, and no costal groove, and no angle is present, and this rib is not twisted. Okay, now and then anterior end is pointed. Now coming to the shaft. Shaft possesses two surfaces. One is the inner surface, this one is the inner surface, and next is the outer surface. This is the outer surface and this one is the inner surface, and it is having two borders, upper border and lower border. How many surfaces? One is external surface and internal surface. Two borders, upper border and lower border. So here in this pic you are seeing the 12th right side rib. This one is the inner surface, and this one is the outer surface. Inner surface and outer surface. Now what are the attachments and relations to the 12th rib? So first we will see the external surface. So this one is the external surface, that is the outer surface, is facing downwards. External surface faces downwards. It gives attachment in its medial half from medial to lateral. One is the levator costae muscle and longissimus thoracis, and next one is the iliocostalis. So three muscles are giving attachment from medial to lateral up to the medial half. So one is the levator costae, more medial, and then longissimus thoracis, and then iliocostalis muscle. So all these are the muscles which are attached on the posterior aspect of the rib cage. Now coming to the lateral attachment from medial half to lateral side, it gives attachment to the serratus posterior inferior, and then latissimus dorsi, and also external oblique muscle. So the abdominal muscle and also the back muscle. So this latissimus dorsi is originating from the crest of the hip bone, and then it is attached here on the 12th rib. Some fibers are coming from the 12th rib, and then it travels to the inferior angle of the scapula, and then it is getting inserted into the tubercles of the humerus. Okay, that means intertubercular sulcus. At the floor of intertubercular sulcus, this latissimus dorsi is getting inserted. Okay, so these are the muscular attachments on the external surface. Now again we will see. So from medial side to the medial half, it gives three attachments that which are present more posterior, that is the levator costae, longissimus thoracis and iliocostalis. After that, from medial half to the lateral side, so serratus posterior inferior is getting inserted, and latissimus dorsi is getting originated, and external oblique muscles of the abdominals are also getting originated. Totally 6 muscles are attached on the external surface from medial to lateral. Okay. Now coming to the internal surface. The internal surface faces upwards. Its lower part of the medial half gives insertion to the quadratus lumborum. So this is the quadratus lumborum muscle is getting inserted here. Okay. And attachment to the anterior lamellae of thoracolumbar fascia. Thoracolumbar fascia above to this muscle. Okay. So medial half. So the medial half on its lower part over the internal surface, it gives attachment to the quadratus lumborum muscle. Above this quadratus lumborum, so thoracolumbar fascia is present. And now coming to the upper border. So the upper border gives insertion to the external and internal intercostal muscles. Internal intercostal muscles. Lower border gives attachment near its head, lumbocostal ligament. This one, lumbocostal ligament. And in the rest of its extent to the middle lamella of the thoracolumbar fascia. So the remaining, so these dotted lines indicating the thoracolumbar fascia on the lower border. Okay. This is about the 12th rib attachments. Okay, on the external surface, internal surface, as well as upper border and lower border. Next, how can you determine the side of this 12th rib? So the pointed end lies forward and laterally. The head lies backward and medially. The concave internal surface faces upwards and medially. This inner surface. Okay. And convex external surface faces downwards and laterally. So with these features we can identify the side, whether it is right side or left side. This is right side. Okay, here the pointed end lies forward and laterally. The head lies backward and medially. Okay, if you see the rib cage, so this 12th rib and over this 11th rib, so the pointed ends almost present on the lateral aspect. Okay, so that one, it lies forwards and laterally. The head lies backwards and medially. The concave internal surface faces upwards and medially, and convex external surface faces downwards and laterally. Okay, so this is about the 12th rib identification. So all these are about the characteristic features of the atypical ribs present in the thorax. Thank you.